7:02.
The Big Interview
With Bongani Bingwa.
18 after 7, we must ask the question, have we as a society and as a country, have we become numb to stories about corruption? There are so many that even on their own might topple democratic governments elsewhere in the world. But one after the other, they hit us day after day, and we just move on to react to the next one. And over time, we forget about them, don't we? Well, our next guest says he's angry. He says he's angry at a health system so riddled with corruption, it has claimed the lives of courageous whistleblowers, people like Babita Deokaran. He's angry at the rampant theft at the Gauteng Department of Social Development, where 2 billion rand was wasted on alternative building technology hospitals. Remember the fogging scandal? 500 million rand spent on sanitizing empty schools. The revamping of a hospital in Carltonville, another 500 million rand. The PEE scandals, and so on, and so on, and so on. But over time, these are just stories because we're waiting for the next scandal. Mark Heywood is a longtime social activist in the health space and joins us now this morning. We're talking, of course, on the back of a piece you have written that outlines all of these issues. What does it say about us that we move away from all of these so quickly as if nothing happened?
Good morning, Bongani. Yes, I think it says that we've kind of become inured to each story about corruption. We read it, we express outrage, and we move on. And by moving on, we allow the corruption to continue. You know, I think that corrupt individuals kind of plan that there may be an exposure at some point, a few days of outrage in the media, but if they stand firm and weather the storm, it will go away, and then they can continue with their activities. And that's precisely what has been happening at the Gauteng Health Department since about 2006, 2007. And, you know, by my estimation, Bongani, I put in the article that it's cost 20 billion rand in corruption. In fact, it's probably closer to 30 billion rand. But as importantly or consequentially, it has cost hundreds and hundreds and probably thousands of lives directly and is causing pain and suffering to tens of thousands of people. And I'm just saying we can't allow ourselves to be dehumanized. We can't allow ourselves to lose compassion and empathy with people who are the victims of this type of corruption.
Let's talk about the alternative building technology hospitals.
Yeah.
Hey, what was that about, and where did we get to with that one?
Well, if you remember at the start of the COVID-19 pandemic, just after the declaration of a state of disaster, there was basically a tender fest, a splurge of massive corruption. Gauteng suddenly decided that it was going to extend its intensive care unit capacity by building what were called alternative building technology hospitals. And it spent about 2.5 billion rand on those hospitals. I investigated it at the time at the Daily Maverick. Those hospitals weren't needed. At least two of those hospitals, one was never completed at Kopanong Hospital. And nobody has ever been held to account. You know, they were not necessary. They weren't built properly to specifications. And it's another example of something where individuals were fingered, where corrupt practices were outlined, but really there's just so much going on that unless somebody keeps an eye on the issue and keeps demanding accountability and action, then we just move on to the next thing. And I believe that the people who are responsible for that are still sitting pretty.
Not only do they sit pretty, Mark, we've often seen where legal issues and litigation arises, taxpayers' money is used to fund their defense. I mean, I remember Danny Mahlangu, the former MEC for Health in Gauteng. I remember her being interviewed by my former colleague at Carte Blanche, Devi Sankri Govender. And she was arrogant then. I would say she remains nonchalant even to this day about the actions she took And it's not as if she didn't know. It's not as if she wasn't challenged at the time. And not only do these officials get away with what they did, we have to foot their legal bills.
Exactly. So, again, to recap, Gladani Mahlangu, at least 144 people died at her hands as a result of closing the Life Esidimeni facility and moving people to NGOs, pop-up NGOs that were just specially created not to care for patients, but to be the recipients of money for the bodies that they took control of. That was 2016. We are in 2025 now, getting to the end of 2025. At last count, Bongani, the Gauteng Health Department, by its own admission, had spent 77 million rand on legal fees to defend Gladani Mahlangu in the arbitration and then in the inquest. But I have to stress, that's at last count. My guess is that that's probably close to 100 million rand. And my question now is, if Gladani Mahlangu gets charged with culpable homicide later this year by the NPA, will we once again be paying for her extremely expensive legal defense? Meanwhile, you have 3,000 people living with cancer on a radiation oncology waiting list whose suffering is being drawn out because the Gauteng Health Department is using legal technicalities to delay or prevent the implementation of a court order that tells it to provide them all with treatment. I mean, it's just disgusting.
Two questions quickly, Mark. Firstly, there are a lot of people who think, or who've bought into the idea that, all of these things ended with state capture. Many of the examples I think we've just reflected on happened long after Zuma was no longer in office.
Yeah.
It's not over, is it?
It's not over at all. I mean, the Gauteng Health Department is a captured health department. It has been repurposed so that it can also serve corrupt interests, and it can be used to extract hundreds of millions of rands. So the capture of that department is intact. There is no doubt about it. But it's true of other Gauteng departments and probably other departments across the country. I mentioned the Department of Social Development. Again, I did an investigation at the Daily Maverick last year, where we saw that over a period, again, of probably about 10 years, tens of millions of rands of money that was meant to be going to children's homes, to mental health care facilities, to homeless people, to food support programs, etc., is being skimmed off. So state capture or departmental capture or corrupt capture or whatever you want to call it is alive and well, and we allow it to continue because basically we kind of fold our hands and say there's nothing we can do about this.
So what can we do?
Well, I think we have to, as citizens, get organized. The NPA, the SIU, the Hawks are now doing a great deal more, and you may have seen overnight that one of the Tembisa tender dons has just been pounced on by the assets forfeiture unit, Hangwani Maumela, who seems to have picked up hundreds of millions of rands from Tembisa Hospital. But, we need to report corruption. We are busy forming a new anti-corruption network in Gauteng, calling it the Babita Deokaran Anti-Corruption Network. So there's lots of little things that citizens can do to monitor, to report, to try to build a different type of ethic of public service. And there's lots of things that we, Bongani, being people who work in provincial government departments, can also do to insist that we are there to serve the public and that we are good public servants rather than part of this corrupt gangs.
You and I will continue talking in the coming weeks and months about some of the work that is being done and how those networks will come together. Health and social activist Mark Heywood. But just reflecting on some of those stories, doesn't it make your stomach turn?
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.